In your experience, how often do physical illness like heart disease, diabetes, blood pressure, and so on connect to mental health issues like depression or anxiety in patients?
Me being a family physician for almost 20 years in my patients, and I think this is across the board, is when a person is any of these or any other diagnosis for that matter or illnesses, especially with the chronic diseases like you've mentioned, diabetes, hypertension, and heart disease, they need to realize and they have to realize that as a patient that their life is going to change because of this diagnosis. A lot of things take place before the diagnosis happens, their lifestyle, how they are taking care of themselves. It starts from where a person's mental health is, how good it is that they actually can prevent certain diseases once they are diagnosed, and how they take it. If they're in the right mental capacity and right mental health, if they are not already dealing with anxiety, depression, or some other mental health or mental illness, that kind of makes it quite challenging for them to take on that diagnosis, which is going to change their life, the way they eat, the way they work, the way they diet, physical activity, and taking their medication. So it affects all that also. And once they have actually actualized the fact that they have that diagnosis, moving forward with that and trying to keep the complications to the minimal, it takes a good sound mind, a healthy mind with good mental health to actually be conscious of the fact that we want to avoid the certain things or certain ways in this disease to avoid the complications and stuff. So I feel like there's a major interaction and connection between the mental health as well as any chronic disease.